test, treat, retest. So diagnose, test, treat, retest. We're trying to figure out this diagnosis. Then what we do is once we actually figure out, we do let them know like, hey, this is what I feel is going on. And then you come up with a prognosis. And the way that we do that is first and foremost, we got to understand that people are going to be coming in pain. They're going to be coming in some kind of discomfort. So we got to kind of like really dive a little bit deeper on our questioning to figure out what that pain level is. Then what we're going to do is once they're out of pain, we're going to switch them over into performance, right? Or priming the body, right? So I got to get rid of the pain first in order to fix the root cause of the issue. And I explain this to the patient, right? First, what we're going to do is get you out of pain. However, you're going to think that you're done with physical therapy. Most people do. They think once I'm out of pain, I don't need to come anymore. That's the problem, because we're not able to fix the root cause of your issue because your pain is guarding that area. So once the pain is down, that'll free us up to fix the root cause so that it doesn't come back in the future. Okay, and welcome to this next video where we're going to talk about custom packages and the hidden benefits. Okay, so custom packages and the hidden benefits. Now, this is one of my favorite lessons to teach inside of this module because this is the one where we get the most, I guess, appreciation. Like people genuinely like reach out to us and then they let us know, they're like, hey, thanks for showing us how to do that. It's so much easier. It's so much cleaner. It's easier to walk the patient through the plan of care and what's, how much is it going to take or how much this is going to cost. And then not only that, my team loves it. My providers feel more congruent when they're discussing treatment plans and pricing. So thank you, right? And it's just like, well, hey, no thanks to me. You guys are the one that are actually taking this information and implementing it. So I want to make sure that I give you guys the same amount of information that I give other students that are inside of our program or other owners that are inside of our program. And they started to make the switch from those kind of it's kind of funny, right? So we talk about like, we got to always have congruency in everything that we say. And we can't tell people that we're going to create an individualized custom plan of care, but we only have 4 package offers. You get a 6, a 10, a 15, or a 20. Which one would you like? But it's custom. So I promise you that it's custom, right? So we have to have congruency in everything that we do. If we're going to tell people that it's custom, you better make it custom, right? And if you're going to cookie cut and just box them into a 6, 5, 10, whatever it is, because, call it a spade, it's just like sometimes we just don't know any better, right? So we want to make sure that we're actually creating custom plans and we're actually being congruent in what we say. So the other thing that I want you guys to understand is that this is like where we're at in the process. This does not include the eval. And we talked about that a little bit before in another video, and that's why I brought it up. But this doesn't include the eval. This is what happens during the evaluation. Okay, so the patient comes in, you got a lead, regardless of where you get them from. They come in for the evaluation, and then during the eval, you guys are going to learn about our 8 Ps. Actually, I might add 2 more, so it's going to be it's probably be 8 or 10 by the time you see that video. But at the same time, it's going to be the 8 Ps to selling custom plan of cares. Okay, so I'm going to teach you guys that. Trust me, I'm teaching you it all. Don't think I'm going to leave that out. Teach you how to create a custom package and not teach you how to sell it. We actually have people selling patients and patients thanking them in tears for, actually giving them what they deserve. Right. And not being like, well, we're going to do once a month for the next couple months, because it's just like patients are just like, they're tired of trying to get results. And then when they go and meet somebody, they're like, well, that was awesome. But, I'll see you again in about 4 weeks, 1 week, because they just don't sell them a custom plan of care. So the biggest thing that I want you guys to understand is first and foremost is the lead is going to come in for an eval. And then during the eval is when you're going to do a couple things. So during the evaluation, you are going to, or your providers are going to walk them through the 4 levels of recovery. Now, this is PT School 101. This isn't anything special. So don't sit there and be like, Robbie, that's amazing. It's just like, not really. It's like you learned it in your textbooks. We just call it something crazy, like something a little bit more structured. So people like, people like alliterations and walk them through. But at the same time, like here, if you have no idea what I'm talking about, body structure and function, action, participation. Right? Prevention, right? So that's it. It's PT School 101. But because you guys know what the body does and recovers, that doesn't mean the patients have any clue. They have no idea how the body recovers, right? So we got to educate them. So patient comes in, they have a diagnosis, right? And I'm telling you right now, I don't care what the script says, right? So the doctor writes like kumbaya on there and they're like, here it is. And you're like, what is this? Like, did they even evaluate the patient? This is always just code. And I talk to doctors, they're like, I put something on the script that's going to get us an MRI, X-ray, surgery, or whatever approved after physical therapy if it doesn't work. whatever you guys do at physical therapy, it's on you, right? So I'll have to tell you a story once. We had a doctor once that wrote grade 0 ankle sprain on one of our scripts. And I called him and I said, hey, grade 0 ankle sprain. He goes, did you evaluate the patient? And I said, no, not yet. And he goes, evaluate the patient and call me back. So that was kind of like his hidden message that this, hey, just be careful what you're going into. So doctors, just whatever they put on the diagnosis, they're ready to rock and roll. It's up to you to figure things out. So, doctors kind of give you like, hey, check the right leg, but we actually have to figure out what's going on. So we diagnose first. Then we're going to do, a lot of test, treat, and retest. Right. So we're going to test things out. We treat it a little bit to see how it responds. We retest it to see if it got better or worse or whatever. Because we're, is this a passive injury? Is this an active injury? Right. Is it, inert or is it muscular? Like what's going on here? Right. Is it neuromuscular? Is it, circulation issue? Who knows? Right. So we got to figure that out. Test, treat, retest. So diagnose, test, treat, retest. We're trying to figure out this diagnosis. Then what we do is once we actually figure out, we do let them know like, hey, this is what I feel is going on. And then you come up with a prognosis. And the way that we do that is first and foremost, we got to understand that people are going to be coming in pain. They're going to be coming in some kind of discomfort, right? Either they can't walk or they can't stand, they can't this, they can't that. They're in 8 out of 10 pain. It hurts, it doesn't hurt. It hurts only when I stand up. It hurts when I've been whatever. They're in pain, right? So a lot of folks are going to be coming in and their normal is 0, but they're going to be anywhere from 0 all the way up to 10. Right? Pain 101. And we got to kind of figure out like the bigger the number, the bigger the gap. So people that are in 6, 7, 8, 9, 10, they don't care what the price is. They just want to come in and get it squared away. People in like 0, 1, 2, 3, 4, right? There's not enough pain there. So we got to kind of like really dive a little bit deeper on our questioning to figure out what that pain level is. And then what we're going to do is once they're out of pain, we're going to switch them over into performance, right? Or priming the body, right? So I got to get rid of the pain first in order to fix the root cause of the issue. And I explain this to the patient, right? First, what we're going to do is get you out of pain. However, you're going to think that you're done with physical therapy. Most people do. They think once I'm out of pain, I don't need to come anymore. That's the problem because we're not able to fix the root cause of your issue because your pain is guarding that area. So once the pain is down, that'll free us up to fix the root cause so that it doesn't come back in the future. Okay. So now we're going to get into priming. What's priming? Well, there's going to be some things that are weak. We make it stronger. Some things are going to be tight. We make it a little bit more flexible, right? Some things that are a little bit more mobile, we make it stable. Some things that are a little bit more stable, we make it more mobile, right? So whatever that looks like, that's what we do here. Okay. And then what we're going to do is once we get with the body, because we don't want to start loading the body, right? We don't want to strengthen dysfunction. So then what we get into is the performance phase, right? This is whatever their goal is, right? Because what we want to do is we want to stretch the pain and pleasure gap, right? So this is their pain, this is their pleasure. This is their pain, this is where they're trying to get to, right? And the bigger this gap, the more bought in they are, right? So we're going to be like, first you're in pain, then we fix the root cause of your issue, then we get you back to doing what you want to do that you're not able to do right now because of the discomfort. And then when you're done, we're going to enroll you over into, or invite you, I always say invite you, into our VIP program, which is going to be our performance enhancement or our performance and prevention program, right? So this is our back-end wellness program, so our VIP wellness program. And then this is where we're going to work on prevention and all that other good stuff. But we just kind of brush over that. Hey, we got a VIP program, wellness, but don't worry about that now until you're discharged. Okay. So why do I tell you guys all this? So when you guys lay out a diagnosis and you guys lay out a treatment plan and you come up with a prognosis, you come up with that plan of care, right? So what's going to happen is you have options here. You got a 6, a 10, 15, or 20 visit package. Whoop-de-doo. If that. Some of you guys don't even have that. Some of you guys just have a 6. I meet owners all the time. They have a 6, 8, or 10, whatever the heck that is. So if that's you, no disrespect, but at the same time, listen up. So we got 6, 8, or 10. So what I want you guys to do is literally when you are looking at these stages here, and someone comes in and they're in pain and you got to get them primed. You got to get them back to performance and you got to prevent. It's like, how long is it going to take you, the physical therapist, to take this patient through each level? So let's just say a patient comes in and they have a hip flexor tear, a grade 2, whatever that looks like, unable to run, right? It's just like, hey, like you're in pain right now with just walking. So I want to increase your range of motion, right? I want to decrease your pain and I want you to be able to walk 10 to 15 minutes without discomfort. And we're going to do that in 6 visits or less. Okay. If we can't get you better in 6 visits or less, then we're going to send you out for a referral, right? Because there's probably something going on that we got to get checked out because your body should be responding. And if it doesn't, we need to get checked out. Okay. So then what we're going to do is once your pain's down and you're stopped guarding because you can't really do anything right now, then we're going to work on your strength, mobility, and flexibility. Okay. This is where we're going to get you back into squatting a little bit, maybe a little lunging, maybe going up and down the stairs, maybe some lateral stuff. Like, we're going to start working on some of that stuff. But at the same time, I still got to make sure your strength is good, your mobility and flexibility. Because since we've been off, right, and these are the words I use with patients, since we've been off here because we're in pain, for every week where we took off, it's going to take about 3 weeks to get back, right? So in your case, you're pretty active, you're a good athlete, right? So that's going to take from 6 visits here. So this first phase will take about 3 weeks. This second phase is probably going to take an additional 3 weeks, right? So this is going to take about 6 sessions. This is going to take about 6 sessions, okay? So then what we can do is get you back into running. Now, you said your goal is to get back to running, I don't know, I'm just going to say a 5K, right? So you want to get back to running a 5K, which I need you running for about 35 minutes, depending on how good the athlete is, right? Some of them are in sub 20s. That's a different story, right? So I want you at least running for about 35 minutes without discomfort, okay? So that's what we're going to be able to do. And then I'm going to have you do this. So first and foremost, I'm going to have you run here at the office, then run on your own, then we're going to assess, right? And then I want you to do the 5K, and then we'll follow up afterwards to see how we feel, okay? Sound good? Awesome. Well, that's going to take an additional 4 to 6 sessions. So ultimately, right, we just created a custom plan of care. 6, I'm going to say that word. That's why I said 4. 6. So we got 6, 6, and 4, right? So we got 16 visits, okay? So now we can tell the patient with confidence that they are going to be able to go through what we just mapped out for them in 16 sessions. Hey, if you do what I say, if you listen to exactly what I say, and you come for all your appointments, we're going to be able to get you out of pain, or at least reduce your pain significantly in 6 visits or less. Then we're going to switch gears and start working on your strength, mobility, flexibility, and then that's going to take an additional 3 weeks, okay? Twice a week, 3 weeks, another 6 sessions, and then we're going to get you back to running. Now, I don't know if that's going to be 2 times a week for 1 week and then 1 time and 1 time, or if that's just going to be like 4 weeks in a row, 1 time a week as you get back to running just to check in. I'm not sure yet. Depends on how you respond, okay? But that's going to take anywhere between 4 to 6 sessions depending on what we need. So ultimately, I feel, right, based on my professional opinion, you're going to need 16 sessions to get better, okay? And that's it. That's all we do. We shut our mouth, right? So we don't tell people that we have options here. We don't tell people it's going to be 16 sessions, but you could buy a 6 or we could buy a 10, right? Ethically, right? There's that word, ethically. I am not going to sell somebody something that I don't think is going to get them better. I'm going to sell somebody something, right? Ethical selling here. So I'm going to sell somebody something and give them enough information of why I'm going to sell them that package, right? 16 visits, because that's what I actually feel through my clinical decision making, then that's what they need to get better, okay? If this patient came in with a total knee replacement, boom, 24 sessions. ACL, well, hey, you might need 30 to 36. Grade 1 ankle sprain, it's just like, hey, maybe 10 visits, maybe 12, depending on, right? So it's one of those things like know your conditions and know how good you are as a clinician to get these people better and progress, okay? And we'll show you later, fill your practice, how to do your active patient reporting and keep tabs on everybody, right? No patient left behind. So that's where we're at. So here's the cool part. Now, all of a sudden, you have 16 sessions, okay? Now you're probably like, well, how do I create a custom plan of care, okay? All you do, and I'm going to bring you over to our cash calculator here. So all you do is you would type in 16 sessions. Let me make this a little bigger for you guys because you want to see big money, right? So let's go over here. So we got 16 sessions. And now all you would do is be like, now in our example, right, that we used previously, we used, what was our number here? 175, right? So 175. So now all of a sudden you just charge 175 and then boom, you just create a custom package. So you tell this patient when you go and you're all like, oh, like it's like, all this stuff. So people get all nervous when they want to present pricing, but it's just like, hey, so this is what we got going on. Now I'm going to teach you how to sell. So I'm just showing you how to create the packages. I didn't show you at all how to sell, but at the same time, I want you to know how we got to this number. And then you'll be able to see, right, and see in our sales training where we talk about like actual, selling custom packages. But for now, I want you guys, this is all about setup and coming up with your pricing. So here you'll be able to see like, hey, this is 16 sessions. It's $175 session, total cost, total package price, total investment is going to be $2,800. Okay. That's it. It's $2,800. We actually had someone the other day, they went through this whole process. And when you see our selling process, just game over because it's so cool. But at the same time, like they went through our sales process, the APs, they followed that to a T and they presented the offer. And the patient actually laughed. She's like, oh gosh, she's just like, that's actually really cheap. I was expecting it to be more than that. She said, I just paid $10,000 at the acupuncturist. It's crazy. So she actually just got all these sessions for PT and the person was just like, oh, that's cheap, right? So when you sell people into custom packages, they only see one price and that's it. They only see the total package price. Now you're going to see some stuff down here. This is for more when we go to sell. I'll walk you guys through how we sell packages and stuff like that, just to give people some options. But at the same time, that's it. And then when you sell packages, you're either going to get payment in full, you're going to get a partial payment, and then monthly payments, right? So we're going to either get a big cash injection, right? Because they're going to pay in full. They're going to pay half up front, right? Which is option number 2, half upfront, then set up monthly payments, or they're going to set up monthly payments, right? So you guys are going to have cash flow coming in, either in a chunk, or what you're going to be able to do. That's why some people in our program, they sell 4 packages, right? And they already made more money than they did last month, right? Because it's just like, that's how powerful this is, right? So selling custom packages. Now, let's say someone comes in, right? Motor vehicle accidents, they need 36 sessions. Boom, $6,300 package, right? Someone comes in, they only need 10 sessions. Boom, $1,750 package. 6 sessions. Boom, $1,050 package. They need 24 sessions. Boom, $4,200 package. Pricing is irrelevant. Or what you can do is you can raise your prices. Now you want to do $225 a session, right? So now all of a sudden we go back to our example 16 and boom, $3,600 package. Now, if you guys, when you see that number, if that bothers you, then we have some work to do, right? Because I want you guys to make sure, and I know I'm going a little longer in these videos versus the ones I usually keep them short, but just know that like right now, if this bothers you, right? Seeing the 16 times 225, 3,600, we have some work to do, right? Because you guys can't have any restrictions. You got to know that people love to pay you. You went to school for 7 flipping years to learn how to treat that thing in 16 sessions, right? So your expertise over the last couple of years is what they're paying for, right? Some of you guys think you put all this pressure on one session and you're like, oh, I don't know. It's just like, you guys are ready for this, right? You're ready for this. This is what you prepared for. You're amazing. You're great. You guys have amazing skill sets. So go charge what you're worth, please, right? And people will love to pay you. I promise you that. Okay, so I'm going to stop here because this is how we actually set up the custom packages. So I'm going to shoot another video here where I kind of walk you guys through some of the hidden benefits. These are actually things that surprised me. They weren't on my radar until you guys started to implement this stuff and started to get feedback from patients and your therapist. I'll cover that in the next video.